Yes, thank you all for being here. And I promised Minnie I would keep this very brief because I'm not noted for my brevity, but as soon as the slides get up, I'm just going to do kind of a brief introduction as to about MS and where we started, where we're going. So it'll be kind of just a brief summary. All right, so just to refresh everyone's memory, MS is considered a chronic immune-mediated disease of the central nervous system. So it's an autoimmune disorder. Any part of the body can get an autoimmune attack. So in rheumatoid arthritis patients, it's your joints. Crohn's disease, it's your gut. Psoriasis, the skin. But with MS, it's the brain. And it specifically attacks what we call the myelin, which is the insulation that helps the signals move from one part of the brain to the next. So it disrupts that communication. You guys are not alone. This is a very common disorder worldwide. Typically gets folks in their youth. Most autoimmune diseases are more common in women than men, but men still get MS. And even though it's most common in youth, we occasionally diagnose people in their 6th and even 7th decade. So these are just some typical MRI pictures. On the left, you see the dark structures in the center. These are your fluid ventricles. That's normal. Here's your brain. All these white spots are areas of scarring or inflammation. So the term multiple sclerosis is multiple scars, and that's what those white spots are. It's another version next to it, and this is a lesion in the spinal cord of a patient. You can see a little white splotch there and up there. The current recommendations from the consortium of MS centers is that you folks really should be getting imaged once a year with your brain to keep your brain in a surveillance monitoring. The cervical spine also needs to be imaged at some point early on in your diagnosis and then periodically thereafter. As you probably know, sometimes lesions happen, but they don't cause you any symptoms. But to us, it still means it's active disease, and that's why the surveillance monitoring is important. All right, so there's been a lot of progress, as I said, in the 40+ years I've been doing this. We know that there are multiple pathways that can happen to the immune system to trigger MS. Back 5 decades when I was in college, the immune system our immunology book was a very thin paperback. Now it's much more complicated than that. So there's T cells, B cells, antibodies, all these things play a role. And we're learning more and more about how these roles interact with each other. You don't inherit MS. So, our kids blame us for many things. They can't blame you for giving them MS. But what we pass on is complicated immune genetics that may increase one's role towards getting an autoimmune disease of any type, depending upon what environmental exposures you may get exposed to during your early years. Some of the environmental issues will include low vitamin D levels, smoking, and viruses. You're going to hear a lot today about the immune role of the gut and the GI tract. Your stomach tract is the largest immune organ in the body. And we're now understanding we got to pay more attention to what goes on in our gut. We now have more improved imaging and biomarkers as well. So again, things are getting much more sophisticated for you. On the left is what a healthy nerve cell looks like. Those sausage-like structures are the insulation, the myelin sheath. So if you ever have run over your electrical cord vacuuming and you strip the insulation off your electrical cord, the signal weakens and your vacuum may shut down. The same thing happens here. The antibodies start attacking the insulation and signals don't propagate normally or don't propagate at all. All right, some of the newer advances. We have, when I was starting, MRI scans were just coming out in the early 80s. And when you looked at a CAT scan and then compared it to what you saw in an MRI scan, it was almost frightening because we were realizing how much we missed because CAT scans just weren't sensitive. There's also new AI programs for reading MRI scans. Rush has that technology from Icometrics. Stunningly amazing. It's much better than what a human can read. So things are getting better. It's getting more sophisticated for us. There's optical coherence tomography, a type of CAT scan that looks at the retinal layer. They're working on new blood and spinal fluid biomarkers. The whole point is that earlier diagnosis means earlier treatment, and that ultimately for you means better outcomes. All right, so as I said, I was around when there were no treatments. We now have close to 30 treatments for MS. The goal of these things is to slow the disease process, prevent relapses, and preserving your function. Because we have many options now, we can more personalize your treatment regimen. It's not, one size fits all. We can actually adapt it based upon your lifestyle, your preferences for how you want to get medications, how frequently you want to get it, and the mechanism of delivery of immune protection. And a growing concept, which is still being worked on, is what we call immune senescence. Again, when I started, it was great. We got people on medications, but, then we realized now 30 years later, well, how long do you keep treating people to modify or suppress the immune system? Do you do it forever? Because as we get older, we need our immune system more to fight things like cancer and infections, which increase as we get older. So the question is, what do we do with immunotherapy in you folks as you enter your 6th and 7th decade? For some people, we may have to take you off medication, given your history and what your medical history is. But so there's a lot of thought is going into this, and this is a huge topic that is still being worked on. So more of that to come. What we have with our newer disease therapies, the B-cell therapy class right now is probably the most actively used. It includes drugs like Ocrevus, Kesimpta, and Briumvi, probably now considered the most effective class of agents. They target the B cells. There are also, though, oral medications that have the convenience of oral administration and efficacy. There are 2 medicines, cladribine and alemtuzumab, that are called immune reset therapies. These are short course therapies that hopefully can have a durable long-term effect. Work's still being done. The good news is a lot of research is being done, and you need to make sure you tell your Congress people not to hold up research funding for political reasons. Research funding benefits everyone regardless of political party. Research funding should never be held hostage for any other reason. So it's important. Speak out to your Congress people about this. The newest class of drug being studied are the BTK inhibitors, or the Bruton's tyrosine kinase inhibitor. They're making their way through their clinical studies. We're eager to see that. There's also a thing called CAR T-cell therapy, which is chimeric antigen receptor therapy. It's where you modify white cells. This is used heavily in cancer treatment, also now being introduced into the MS arena, still in clinical trials. But again, the trend is we are developing highly effective, targeted, safer therapies for you. Symptom management is important. Fatigue is a huge component of MS. You guys out there with MS know that. There are certain medications, modafinil is one of the most actively used, but exercise and mindfulness therapies. Minnie was showing you the breathing exercises. A great mindful practice, just slowing down, taking some deep, slow breaths. Mobility, as I said earlier on, the medicines can only do so much. You got to complete that circle, and that's where the physical adaptive programs come in. So work heavily with your physical therapy people. There's even things being done called functional electrical stimulation. And of course, we heavily support adaptive yoga and even Pilates as a way to help keep your muscles from becoming too stiff and spastic. A lot of the patients you see in Minnie's class, they're able to get off their muscle relaxants just from doing these exercises. And that's a good thing. Your liver will be happy it's not seeing so many pills in it. Cognitive issues are also, a concern. Cognitive training tools are being worked on. So basically, there's an integration of neuro rehab issues and technology that are trying to help you with symptom management. Lifestyle issues, we're going to hear more about the dietary concerns. The American diet is not a great diet. We really need to focus on a more anti-inflammatory diet. Exercise, we talked about. Vitamin D levels play a role with the immune system, and all of us in the Great Lakes area, we will have no sunlight from November till, the end of March. So our vitamin D levels plummet. Make sure you get your vitamin D levels checked. The important supplement in vitamin D is vitamin D3. That's the one you want to focus on. And mental health is important. MS can be a depressing illness. If you are struggling with this, seek out help. But also remember, things like mindfulness and practices like adaptive yoga can also help you with your mood, and become a member of a support group. I know there's members of the MS support group here today. There's help in numbers, right? So join your partners in crime here and learn from them. You become a team. All right, new research horizons are remyelination therapies, different neuroprotective therapies, stem cell therapies, gut microbiome research, digital monitoring apps. So there's a lot being done. This is a very, very good time for you folks because there is a lot of good progress. So again, earlier diagnosis, better therapies mean better long-term outcomes. MS is not the dreaded disease it was half a century ago. You can live a normal life expectancy and hopefully preserve a lot of independence. It's going to take more effort, right? Of course, but you can achieve this. And again, the goals have shifted from not just slowing the disease, but preserving your brain health and your quality of life. So again, tremendous progress in the past quarter century, great new treatments. And I want to also thank, as many did, our sponsors. We wouldn't be here today if it weren't for the research and efforts they put into this progress. So things are looking good for the future.